When people don't feel comfortable when they smile, it really can be a hindrance on their life, both professionally and personally. I have an Irish background, and there's always the big joke about Irish people having awful teeth, and my mom was one of those folks who had all her teeth removed and wore dentures from a young age. Joining us is Dr. Dan Davidian of Sedation Dental Care, and one of your patients, Cedric McKinnon. Thanks so much for coming on.
Thank you for having us.
You know, so my mom would be one of those terrible cases that she just had all her teeth removed because she couldn't stand crooked teeth anymore. But it's a shame because you could have fixed, and she wears dentures since she was in her 30s, but you could have really fixed something like that, a case like that.
Oh, absolutely, absolutely. There's, you know, dentistry over the last, 20, 30, 40 years has changed.
It's come a long way.
Come a long way, come a long way. Now we can, if people are missing teeth, we can replace teeth with implants. If they have crooked teeth, we can, fix crooked teeth. We can close spaces, and we can do almost anything with dentistry nowadays.
Now, Cedric, when you came to Dr. Davidian, what were your wishes? What did you want?
I just wanted a nice smile. In the past, I've gotten compliments on my smile, but, you see things that she says, well, this isn't right and this isn't right. So actually, I met his wife, Tracy, first, and she was very kind. It says, they didn't jump on me or anything, but they called me back and placed me in this program, and from that point on, it's just been wonderful.
So, but with the before and after of the dental work that you had, the cosmetics, describe what you did for Cedric, Dr. Davidian.
With Cedric, we had he had a fairly nice smile from before. He had the cant of his smile was actually fairly crooked, and he had a lot of spacing, and so. You could see when his facial structure, when he would actually posture his head differently to kind of almost straighten his teeth by posturing his head. So we were able to straighten out the entire bite, from side to side, and we were able to close a lot of spaces for him. And I think we gave him a great result.
You have just a spectacular smile now. How did it change your life, Cedric?
Well,
do you feel more confident?
Yeah, I feel a little bit more confident.
You're a good-looking
really.
guy,
Thank
so.
you. But no, really, you get a lot of compliments. The compliments just started rolling in. I didn't expect that, but I'm talking about from day one, even before we left Vegas. I happened to go into one of the food courts at the place we were staying in, and folks were just like, wow, your smile is just brilliant, and so, at first, the first day or so, you're trying to get used to it, and now I'm kind of used to it, and I sing his praises all the time, so, but yeah, it was definitely a change. Now,
you say Vegas, your office is here, near Rex Hospital in
Absolutely,
Raleigh,
it's in
but
Raleigh.
You do some of your advanced training in Las Vegas.
We do. We go to the Las Vegas Institute and do advanced training there for cosmetics, and so every once in a while we'll take a patient out and let them experience the. Because
the cosmetic dentistry really is much more of an advanced specialty thing. You can't just say, oh, I'm a cosmetic dentist.
Well, it's not a recognized specialty per se, but it does take a lot of extra training.
More training.
So, someone can go out and say they do cosmetics, but if they haven't had, extra training and really been trained on the nuances of what makes a beautiful smile and how to correct it and the different nuances that are involved in that, then, it's kind of, you get an in-the-box smile. It's really a different type of smile. Mm-hmm. So we're trying to really focus on what matches the patient and what matches the patient's facial structure,
more customized,
and lip structures and different values in the porcelains and a lot of technical stuff that you just don't get with your average dental training.
Okay. And what is the recovery time like for a procedure like Cedric had?
Cedric's was, it's interesting. We did a lot of, and I don't know if you can tell from the before pictures, we did a lot of gum surgeries on him. So we actually moved his gums with probably 2 or 3 millimeters, exposing a lot more tooth because the teeth were very, very short, and we just couldn't get the correct proportions.
So you can actually fix that if someone has a real gummy smile. You can fix that
absolutely,
too.
Absolutely,
wow.
Yeah. That was one of the most exciting parts of his case because his teeth. you know, the correcting of the bite and the smile were definitely something we wanted to do, but getting the gums, the first time we talked, that was my main concern. I said, you know, we got to get these
properly
gums
aligning that as well.
Exactly.
All right, and now you do a lot more than just cosmetic dentistry. Why don't you come back again and we'll talk about sedation dentistry, which I am particularly interested in because I've become more sensitive with age, it seems.
Absolutely, that would be wonderful.
So that's a whole other part of your practice.
A whole other part of our practice that is, we'd love to come back and talk as much as you'd like.
Okay, great. Thank you so much, Dr. Davidian and Cedric. Fabulous smile.
Thank you again.
Thanks so much.